Welcome. My name is Peter Strong. I've been offering online therapy for treating agoraphobia for many years now. And if you're looking for an online treatment plan for agoraphobia, then I do invite you to go to my website and learn more about this online therapy service that I offer. All my therapy sessions are done via Skype, which means that we can see each other. But of course you can have your sessions at home, and this is extremely important if you're suffering from agoraphobia. So the treatment plan is based on a system that I've developed over the years, which is called mindfulness-based exposure therapy. You will undoubtedly be aware that any successful treatment for agoraphobia must involve some form of exposure therapy. However, the classical approaches tend to be really one of trying to overcome your anxiety by just re-exposing yourself over and over again until you develop some sort of confidence in the fact that you will not suffer panic attacks if you go into the challenging situation. However, it is equally possible that traditional exposure therapy will simply aggravate anxiety. So I've developed a rather more strategic approach called mindfulness-based exposure therapy, and this really involves training before you do each exposure. So we actually run through the scenario, the particular challenge in the mind. We imagine going into that situation in order to find any habitual anxiety reactions that may be present. When we find these anxiety reactions, we then use the various techniques of mindfulness therapy to neutralize those reactions, to effectively heal the anxiety so that you no longer experience anxiety in that situation. So we do this beforehand. We train with the anxiety, the anticipatory anxiety. One of the techniques involved is breaking the habit of reactive identification. This is the primary problem in all anxiety disorders, whereby we become blindly identified with the anxiety reaction. We have to train with the anxiety so that we do not fall into the anxiety and become the anxiety. Instead, what we're training to do is develop a mindful presence of the anxiety, where you are independent from the anxiety, where you are the observer of the anxiety. When you can train to be the observer, then you are much less likely to be overwhelmed by the anxiety. So it's rather like watching a movie on a screen. You can watch an anxiety scene on a movie, but not become anxious as the observer in the audience. So this is the kind of training that we do. We learn to see the anxiety without becoming overwhelmed by it. We then develop another very important part of mindfulness training, which is essential for the effectiveness of this treatment plan, and that is to develop compassion for the anxiety itself, seeing it, of course, first of all as an object and not who you are. You are the observer, not the object being observed. So when we get to that place, we can then start to respond with compassion for the anxiety emotional object itself. We can help it heal. we can start exploring ways of working with its structure to help it heal. Very often this involves working with experiential imagery, the imagery of the emotion itself. For example, where do you see the image? What is its position in the body or the mind? This is very important. This is part of its imagery, and it's part of what makes the anxiety work. You would also want to explore how large the image of the anxiety is. You would want to explore the color of the imagery and many other properties like that. The image structure of emotions is what makes those emotions work. So when we see the imagery more clearly, we can begin to experiment with changing that imagery. And this is how we can help the anxiety heal. So we are training the anxiety to change its imagery and heal in the process. So this is the kind of thing we do before we do the exposure challenge. After we have trained with it and we can imagine doing the challenge without anxiety, then we go ahead and do the live challenge to test out our training. If there's still anxiety present, then we would repeat the process and train with that fresh anxiety and the particular triggers that trigger that anxiety. So in this very strategic way, we reinforce the pathways that lead to the resolution and healing of that habitual anxiety reactions. So we train with the anxiety until it heals. If you follow this kind of strategic treatment plan, then you will see changes very quickly, and indeed most of my clients are able to see significant improvements within the first 3 or 4 sessions, because I'm giving you tools. I will be teaching you practical mindfulness-based tools that you can apply yourself at home on a schedule that works for you, and that's what's most important. So if you'd like to learn more about the mindfulness therapy approach for treating agoraphobia, and you like the idea of being able to work with a therapist online, then do please read more about this online therapy service on my website, and do please contact me, and let's schedule a Skype therapy session. Thank you.